Welcome to Be Well. Thanks for being with us today. I'm Jonathan from Your Why, and I'm very grateful to have the opportunity to bring to you these conversations with leaders in the field related to living a mindful, vibrant, fulfilling life. Today, we are fortunate to delve into a topic that I look forward to learning a great deal more about, and that's the world of Medicare. And specifically looking at the coverage options for those that are challenged with chronic illness. We are fortunate to have as our guest today, Terry Snow, who has over 30 years of experience as an insurance professional. She told me just recently that Medicare is one of her favorites to be able to work with, something that is very rewarding, namely because it's such a challenging area to mediate and truly understand. So today we're going to have the opportunity to get much greater understanding of the world of Medicare. Terry, welcome. Thank you for being with us.
Thank you for having me. It's my pleasure. I'm really happy to be here.
And throughout our conversation today, we'll put up some information at the very end, so how you can email or make contact with Terry if you have follow-up questions. But this is also your opportunity to get information, so feel free to put into the chat any questions that you may have. But we're going to launch right in and see what we can offer up front. So Terry, first off, what is a chronic illness, and how prevalent is it in the population of 65 years and over?
Yeah. Thank you for the question. So chronic illness, chronic disease are defined broadly as conditions that last 1 year or longer and require ongoing medical attention. So a chronic illness by definition cannot be cured. The good news is, though, that chronic illness can be successfully managed and their symptoms can be reduced with lifestyle adjustments, medication, and other treatments depending upon the illness. Now, unfortunately today, 80% of people 65 and over have one chronic illness. And 68% of people 65 and over have two or more chronic illnesses. It's just startling, those numbers.
I was going to say that's a staggering number, and then I look at what that impact is on the healthcare system, but also as an individual to be able to mediate and provide for getting the kind of care you need. We all know how expensive healthcare is, and so I just that is phenomenal. I mean, just so what is the place that Medicare? How did they intervene in relation to chronic illness? But before we go there, if you would, so what are examples of chronic illness? You kind of gave the definition of it, but what does that mean in practice?
I'll name a few. I'll give you a few, and this will give you a broad idea. Great. So chronic heart failure, diabetes, cardiovascular disease, COPD, cancer, Alzheimer's, end-stage renal disease, and ALS are just examples of some of the chronic illnesses.
Wow.
Yeah.
So I think there is Medicare has what's called, a chronic special needs plan that addresses some of these chronic illnesses. So what is the chronic special need plan per se?
So there is a specific Medicare Advantage plan that's designed by the carrier. So United Healthcare has a very nice chronic special needs plan that's designed specifically for people with certain chronic illnesses. And we'll go into which ones later. I'll let you know later which ones exactly. But our plan is designed to meet the needs of that population.
Wonderful. And my understanding would be it wouldn't be just doctor visits, but it would also include prescription and.
Oh yes. Mm-hmm. Oh yes. Yes. It's a full product with the standard coverages and then extra benefits, and there's several of those. Yes. That's all in the details within the plan.
And how is that different than other, Medicare programs out there?
Yeah. Okay. So there are Medicare Advantage plans, which people quite often know of or have heard of. And then there's the special needs Medicare Advantage plans. So the primary difference with a chronic special needs plan is called care differentiators. Say that word 3 times fast. Differentiators. I practiced before we started, I'll be honest.
Very good.
So an individual, what happens when you, so a care differentiator, let me say, what it does is the members will have a multidisciplinary team of physicians catering to their healthcare needs. So that will include your primary care physician, any specialist you might have, physical therapy if you have a need for that, and then behavioral health specialists. So that is your multidisciplinary team. Now, an individualized care plan is developed for each member because you're in a special situation. It's a unique situation to you. And as I said at the beginning, you may have more than one chronic illness. And that is really you need that team that's looking out for you. What is done at the beginning of the enrollment time into a special needs plan is what's called a health assessment. And that's something that I do one-on-one with my members if they're enrolling in the plan. And we go through several questions about their current health status. I'll ask them questions. And that information is then passed on to their doctor, to their primary care doctor that they select. So that information then already starts the process of how they're going to be treated, right from the beginning. The doctor's going to have some information. Now, another aspect of care differentiators is there's a high level of clinical accountability and reporting to CMS. And CMS is the agency that manages Medicare. So special needs programs have an extra tier of, I would say, a higher level of accountability and reporting. There's also a high degree of collaboration between your team of specialized physicians with their primary goal of being the improvement of your health outcomes. So that is what they're focusing on, the goal of improving your health outcomes, giving you the very best possible outcome and using all possibilities, not just medication. Could you, what else will help you have a good quality of life and reduce your symptoms? Another aspect of a special needs program is it provides a year-round ability to enroll. So you aren't just limited to that annual enrollment window that many of you may know about, which starts in October and ends in December. That's the annual window. When you have a chronic illness, you have what's called a special enrollment window, which is all year long. And that's very important.
So you can enter in and get services and get this team care at any point in time. You mentioned the accountability and reporting being at another level.
Yes.
And so what's entailed in that? Is that like best practices? Is there communication to? Are there certain measures that they're being assessed on to ensure that their best practices are being met in terms of implementation?
Yeah. That's a good question. And to be honest, I don't exactly know what at the CMS level they do when it comes to a special needs program. But what was very clear is that the higher level of clinical accountability is there. They know that those members that are in those types of plans need an extra level of attention, let's say an extra level of care, more attention to the details. They need your doctor to be very engaged and very active in your care.
That's great. And I like what you were sharing in terms of a focus on the health outcomes.
Yes.
That way, as a patient, that, as you said, symptom reduction, quality of life.
Yes.
And that's being measured, it's being tracked. So you're able to see some movement. And often I would think with chronic illness, you want to have the potential to improve your quality of life. And often as you encounter a chronic illness at a particular time of life, that can be very challenging to integrate into your life. And so to know that you have the ability to move forward and have that quality of life is so important.
Absolutely. I think it's everything. What healthcare should do is help you get healthier, help you take good care of yourself, provide you peace of mind, feeling a sense of you're being cared for, right? You're not trying to figure it out as you go. It's especially true when people are first diagnosed. with a diabetes or something like that, let's say, if they just don't know what to quite do. There's a lot of information that'll start coming at you, and it's kind of overwhelming. And I've seen this in my experience, that people kind of freeze and they tend to go back to their old habits. They just go, forget it. I don't know what to do. This is too much. So it's nice to have someone advocating for you, someone that's giving you a road, a pathway to walk on. And I feel that a special needs product does that, in that you have a team.
I tried to write that down quickly. If you wouldn't mind reiterating who,
Okay.
who and what that team is. I think you mentioned obviously
Okay.
primary care.
Yeah, primary care. Any specialist you might have. So say you have a diabetes, let's say you have diabetes and you have a heart, you're going to have two different specialists, right? They need to be in communication, right? And then you're going to have physical therapy if that's part of what's going on for your illness, and then behavioral health specialists.
Wow, that's comprehensive. It's great.
Yeah, I think so. I love
great
it.
to hear that that's all involved.
Yes.
Do all chronic special needs plans have the same aspects, this team and other things? Are there certain commonalities amongst the different chronic special needs plans?
Again, among the chronic special needs plans, yes. I do have that written down to tell you exactly, because they have something in common. I didn't want to miss any of it. It's a little detailed, so I want to be sure and tell you.
Great.
So what all chronic special needs plan have in common are three things, but I'm going to go into the details. So you have a care management model. That's first. You have the care differentiators that I already went over earlier. And then you have that year-round enrollment period. So all special needs plan have those three aspects. Now, let me explain what the care management model is.
Please.
It's going to provide you the health assessment that I talked about at the beginning, where we're going to go, if I were to help you, let's say, if you were to call me, I would go through a health assessment with you one-on-one. You're going to have a high-risk diabetes program if your issue is diabetes. You're going to have a cardiac rehabilitation if that's what you need. You're going to have a high-risk heart failure program. You're going to have a nutritional program, and for United Healthcare, we use Mom's Meals. And you're going to have a case management team. So those are consistent across all special needs products, not unique to my product that I might suggest with United Healthcare. But that way you would find consistent.
That's fantastic. I love the nutritional component.
Yes.
And again, to know that there's these aspects that are common to all. I mean, it's a very comprehensive support system.
Yes, I agree.
And I like what you were saying. I mean, my assumption from what you've shared is that you are that advocate in terms of ensuring that we get the program that is specific to what our needs are.
You said it before I said it. I consider myself an advocate. That's exactly what I consider myself. I have been an insurance agent for 30 years. I have always considered myself an advocate. I work for my members. My job is to help you have your best outcome, to help you figure out, through us working together, what is the right product for you, whether it's a special needs product or another product, whatever that is. But I appreciate you using the word advocate, because that is really how I view myself.
Well, I 30 years in the industry and just the passion that you bring to it. And I really appreciate you and doing the work that you're doing.
Thank you.
What is the criteria for someone to be eligible for United Healthcare, the chronic special needs plan?
Yeah. So you must have one of these, you must be diagnosed with one of these three diseases or conditions. So diabetes is one, chronic heart failure, or a cardiovascular disorder. So that can include cardiac arrhythmia, coronary artery disease, a peripheral vascular disease. So anything related to the heart, really. Those are the criteria for our special needs product.
Right. And how would someone who is interested in the product that you're talking about get more information on United Healthcare programming?
Right here. You can reach out to me. If you'll notice in the chat, my email and my phone number have been listed at the top. Hopefully you can see that.
Wonderful.
Yeah, it's right there. So you can reach out to me directly. You can also look, if you prefer and you already are working with an agent with United Healthcare, reach out to them and ask them. You know, you might already have someone you've really enjoyed working with. Please reach out to them directly. And then the third option, if you don't want to work with someone personally, there's a phone number if you have United Healthcare on the back of your card that you could call and ask about the plans. I always think it's best to have an advocate, whether that's me or another person locally. I'm right here. I'm sitting in my office today in Poway. I'm right local. I meet with people on Zoom like we're doing right now, or at their home or at my office. So just have someone, have someone work for you. That's how I feel.
That's wonderful. We were talking a little bit earlier, and I want to give you an opportunity, what's on the horizon in terms of Medicare coverage, and what do you see? I mean, each administration that comes in has particular focus on healthcare needs. And so I'm wondering what you're aware of or what you're hearing.
Yeah, sure. I'd be happy to share. So every year, the insurance companies, the carriers, they submit their plans to CMS, who then approves of the plan changes or additions that they might be making. What I would share with you about this administration, you've probably all heard, it's been in the news, of the term Medicare for all. That's out there quite a bit. But I will tell you what Biden, our President Biden specifically said, was that he would like to reduce the Medicare age down to 60. So that is something that he is very serious about. I don't know how much traction that'll get. That would be the first step towards Medicare for all, let's say. But, there are a lot of moving parts in the Medicare world, if any of you here are already on Medicare, you will know that. So that is something our president would like to see happen.
Yeah, that's a very bold move in terms of providing that kind of coverage. I know, that healthcare needs are a tremendous financial, can be a tremendous financial burden, and especially later in life when you talk about chronic illness affecting 80% of those over 65, and the 68% have more than one condition. I mean, that's pretty impactful. And so
it's so impactful. It's so impactful.
Yeah.
What's nice about the details on any Medicare Advantage plan is how they're going to limit your costs, whether you're in a special needs product or another type of Medicare Advantage product. You really know exactly what your costs are going to be. They generally, the products that I represent with United Healthcare, all have a max amount of pocket in any 1 year. So you know where your costs are going to go. And that is very, very beneficial for planning, for figuring out how to take care of whether it's you or a loved one, how to manage their care, how to help them.
That's wonderful. Well, Terry, anything you want to leave us with today?
You know what I really appreciated about this series, Mindfulness? I really appreciate that. So something I do, just as a side, I'm a volunteer yoga teacher for Silver Age Yoga. It's Silver Age Yoga. You can Google it, look it up. It's Silver Age Yoga. And they do programs at YMCA, or excuse me, not the YMCA. They do it at senior centers right now. They do it at other locations. So that is something that I think is very important aspect of mindfulness. And I really appreciate what United Healthcare and the YMCA have formed is their partnership together.
Yeah.
Because staying active, being healthy, keep moving, staying engaged with life, all of those things. When you're dealing with an illness, maybe you're dealing with a family member that has an illness, that takes a toll on you as well. So anything you can do to help yourself stay mindful, stay going in a direction that's going to elevate the quality of your life is so important. And I appreciate the YMCA for that so much.
Thank you, Terry. That's a wonderful testimonial on behalf of our organization, our association, because I know, our commitment is to serve all, and our active adults is a very important demographic for us in terms of our membership, and the different opportunities we provide in terms of yoga, chair yoga, water. As well as just the community that it provides. In coming out of the pandemic, our active adults were really the first to come back into the branch because they were really seeking that the ability to come together as community and really missing the opportunity to exercise with their friends. And so I appreciate what you share,
Yes,
and also just
absolutely.
to be able to bring this information to our association and really to the community. So Terry, thank you for your time today. Thank you for sharing your expertise.
Thank you so much for having me.
Yes, you're very welcome. And to everyone, thank you for joining us today. Terry's contact information or email and phone number, feel free to reach out to her with any other follow-up questions. And until we meet again, please be well. Thank you very much.
Thank you.